I'll go ahead.
Alrighty, let's see if I can share my screen here. There we go. Okay, let me know if y'all can't see that, but I'm hoping it's visible. I know I gave my introduction earlier, but I'll just go ahead and say it again. My name is Isaac Fall. My pronouns are he, him, and I'm the prevention manager with the Office of Homeless Youth, which is within the Department of Commerce. I think probably most folks on this call are familiar with the Office of Homeless Youth, but for those who aren't, we direct the state's funding, practice, and policy, all as it relates to youth homelessness. We're a pass-through agency, meaning that we contract out all our dollars to community-based organizations to provide those services. But we also provide technical assistance, and we also provide like policy and strategy support when it comes to anything regarding youth homelessness. So speaking of strategy support, we have our strategic plan on youth homelessness prevention, which is in the form of a report titled Shifting Services and Systems to Prevent Youth Housing Instability, which we will talk about today. So this is going to be just more of a high-level overview. I know, well, maybe there is more time now, Sarah. I don't know, since it sounds like the agenda kind of got cut down a little bit, but yeah, this is
so just take your time and go for it.
perfect. But yeah, this is definitely intended to be a little bit more of a high-level overview, kind of the cliff notes of the work and what we're doing and where we're at now. But I'm hoping that, as we go through this presentation, y'all might get thinking a little bit more about your work and how it intersects with some of this stuff. And maybe some different things that you're able to bring to it, if you want to get involved. But again, this is the state strategy on youth homelessness prevention. So our agenda for today is we're going to go through a background on the work. We're going to look at the formation of the Youth Homelessness Prevention Steering Committee. And that steering committee brings the voice and lens of lived experience of homelessness and systems involvement to all the various spaces that are working to implement the strategic plan. And we're going to look at an overview of both the preliminary strategic plan and the final strategic plan, and then where we're at now. So like, what are we doing? What are the current efforts? Who are our partners? How are we approaching this work? So a little bit of background, in 2020, the Washington State Legislature invited the Office of Homeless Youth to create a strategic plan on the prevention of youth homelessness. This work was a collaborative effort between OHY and 2 community-based organizations, along with a steering committee of young people with lived experience of homelessness and/or systems involvement, and caregivers that have either parented or supported a youth who has experienced homelessness and/or systems involvement. A little clarification on the word caregiver. So that could be bio, so maybe parents or guardians. It could be kin, so maybe relatives. Could be like a foster parent, or it could be, what you might think of as like an informal host home or like an informal foster parent where a young person is just staying with someone, right? They're crashing there. So that's what we mean when we say caregivers, but that was that steering committee, right? Young folks with lived experience, as well as caregivers who had provided care to young people with lived experience. And through this work, so again, the legislature invited us to create a strategic plan. The first step was we created a preliminary plan. And a lot of that work, we didn't have the full steering committee on board at that time. So it was more so like focus groups with young people and caregivers across the state, and a lot of partnership with our state agency partners to come up with the preliminary plan. And that plan looked at like early recommendations. It looked at root causes of youth homelessness and really like kind of teeing up the stage for the final strategic plan. And then we had that full steering committee, again, the young people and caregivers, we had that fully recruited. And then we put out the final strategic plan in like August or September of 2021. So it's been out for about 3.5 years now. And it took a while to get some funding to support the steering committee long-term and to kind of get everyone rallied around this. But now we're finally pulling that plan back off the shelf and working on it. So the steering committee, as I have mentioned, we partnered with a couple community-based organizations. Those were Communities of Color Coalition, their acronym is C3, and Innovations Human Trafficking Collaborative, their IHTC, And so those two community-based organizations, as well as folks from the Office of Homeless Youth, they formed the planning work group to really plan how those meetings were going to be structured with steering committee members, how they were going to go about developing content for the plan, who else they were going to bring into those spaces. So that was the planning work group. And then we had 10 caregivers, which we defined earlier, and then 12 young people with lived experience. And this was our holistic strategy that we were looking at. OHY, we held those system partnerships and brought subject matter experts from state agencies to help inform the work. Again, whereas C3 and IHTC more so collaborated to ensure that the steering committee was supported and felt equipped to engage in discussions that developed all those recommendations from the plan. For the steering committee, we focused really hard on intersectional recruitment. So it was a mix between young people and caregivers from urban and rural areas with an emphasis on young people over caregivers. We prioritized folks identified as queer, trans. 95% of the committee was Black, Indigenous, or young people of color. Also further considerations were given to folks who identified having neurodivergencies or any sort of mental health considerations. And you might ask why, like, why did we so overwhelmingly prioritize this? Well, I think we know through so many data sources, right, that so many young people of color, young people with disabilities, queer and trans young people are negatively disproportionately impacted by systems and homelessness. So this is data from our 2024 youth and young adult homelessness landscape scan that we released last year. Again, I want to reference all this stuff with the steering committee was a few years prior, but I think this really gives us an important snapshot to look at when we're looking at disproportionality. So if you look at the entire, and it says the state population of 10 to 24-year-olds, usually we're looking at 12 to 24, but just the administrative data that we had dated back to 10 years. So of 10 to 24-year-olds, this is the breakdown of race across the state. So 62% white, 20% Latin of any race, 5% multiracial, 4% Black or African American, 7% Asian, 2% American Indian or Alaska Native, and 0.4% Native Hawaiian or Pacific Islander. But if you look at youth and young adults who are accessing the homelessness system, youth of color are far drastically overrepresented in that system. And particularly, you look at Black or African American young people, they show up at 4 times the rate in the youth homelessness system compared to the general population. So huge disproportionality in that landscape report as well. 36% of young people identified as having a disability. And we know that that number is probably underreported because oftentimes it does not include things like neurodivergencies, depending on how those questions are asked. So again, this is why we really chose to focus hard on this intersectional recruitment. And this is how that steering committee was composed. So the prevention continuum. So this continuum was initially released in the preliminary strategic plan. So that was that first plan that came out, again, that really set the tone for that final strategic plan. And we utilized a public health approach to prevention. So we categorized it along stages of universal prevention, primary prevention, early secondary and later secondary, as well as tertiary prevention. When we look at universal prevention, we're looking at just broad population level education, right? It's not necessarily targeted services. It's more so just, it might be like a flyer in a resource center or a flyer in a library or a class that's available to anyone, just broad population-based education. That's universal. When we're looking at primary though, we're looking at folks that are at the point of, I think probably the best example is like a family's having some conflict. Maybe the young person has run away from home, right? They're experiencing that conflict. And now we're looking at how can we provide some more targeted resources to prevent that situation from spiraling more out of control. And then when we're looking at early secondary, this is when young people are starting to have some level of system involvement. So maybe that's like probation and diversion within the juvenile court context. That might be like outpatient treatment within the behavioral health system context. It might be maybe there is like a CPS case, but there hasn't been like a dependency hasn't, or the state hasn't taken what's the word I'm looking for? A dependency hasn't happened yet. Then there's later secondary prevention though, where young folks are more formally involved in the system. It's leading to out-of-home placement. They're in foster care. They're in an inpatient facility, or they're in like juvenile rehabilitation or juvenile detention. And then you have tertiary prevention, where we're really looking at young people who are already experiencing homelessness or who are at the point of experiencing homelessness when they're releasing from a system of care. And you might ask, how can we prevent at this end of the continuum? You might think, well, they're already at that point. They're already experiencing homelessness. But when we're looking at tertiary prevention, we're really looking at how can we swiftly prevent their ongoing experience of homelessness, and how can we prevent the recurrence of homelessness. So prevention can really take place at any stage in the continuum. And I know I mentioned like broad population-based education for universal prevention. A good example of primary prevention would be currently like the community-based family reconciliation services pilot model that's currently happening. And like one site, I think in Snohomish County, that's a good example of primary prevention. We have our Housing Stability for Youth in Courts program, which supports young people and their families involved in juvenile court system. And that's a good example of kind of early and later secondary prevention. We have our system of care grantees, a number of them in the room, who are supporting young people who are transitioning from systems of care and are transitioning to the community and are at risk of homelessness. That's a good example of later secondary and tertiary prevention. So again, prevention can occur at any stage in the continuum. And that same preliminary report also looked at root causes of youth homelessness. And those were identified as structural factors, system inadequacies, and relational and individual factors. The structural factors include things like poverty, racism, lack of affordable housing, lack of livable wage jobs. System inadequacies include silos across state agencies, lack of cohesive system entry points for services, lack of outreach and engagement strategies. And just, I'd say probably overall, just the patchwork of services that exist across the state, right? Sometimes we have some really great models, some really great ideas and ways of doing things, but they only exist in one community or just a few communities. It's not statewide. And so that's another huge issue when we look at system inadequacies. And then finally, those relational and individual factors that young people in those focus groups identified were mental illness, substance use, trauma, domestic violence, conflict with parents when it came to their sexual orientation or gender identity, and all of which oftentimes impact young people's familial relationships. Also coming out of that preliminary plan were a number of system gaps that were identified. I'm not going to read through all of these, but maybe just to kind of pick some out, especially as they relate to those root causes, silos across different agencies and departments that create a system of disconnected services that youth and families must navigate. Programs and services currently in place to serve youth and families are not working for communities of color. Prevention programs lack flexible and integrated funding streams. Young people labeled as high functioning autistic, oftentimes slipping through system silos without receiving appropriate services. So these are just some of the system gaps that are identified, and I'll make sure that we can get these slides sent out afterwards as well. So if folks want to take more of a look at those, they can, and I'll make sure to link those to plans as well. So what the data tell us, again, more findings from that report. The youth of color and LGBTQ2S+ youth experience homelessness at disproportionately high rates compared to their white, straight, cis peers. And we also saw that in that data snapshot from the landscape report that I showed earlier. Neurodivergent youth are disproportionately represented in housing unstable youth. Youth homelessness is prevalent in both urban and rural areas, hence why we did that urban and rural recruitment and wanted to ensure we had representation from all communities across the state. Youth serving organizations are predominantly in urban areas and oftentimes do not represent the demographics of the youth they serve. And youth of color and queer, trans, and people of color youth don't feel welcomed or served in many of these organizations. So again, these are just more like snapshots on what the data tell us, but there's a lot more in that report. So moving on from the preliminary plan to the final plan, which is what we're going to be talking about now. This is like the whole foundation of the final strategic plan. So it was founded on these four main pillars of supporting whole family well-being, universal support for basic human rights, mitigating racism and trauma in systems that serve families, and shifting resources to BIPOC communities. As you see here, there's a number of what we're naming as recommendations. These are more like the recommendation categories is what I would say. And then if you dive into the report, you'll notice that there's probably like 80, 90, 100 something discrete recommendations where it's like, this needs to happen or in order for prevention to occur, right? But this is like the overall framework, these thematic pillars that we always want to like reference back to ensure that we're fully aligned in our approach for implementing this strategy. In that report, I got a couple pages here on the high priority recommendations. I'm not going to read through all of them, but I'll just highlight some of the ones here. So one of the recommendations is a new service system for family well-being that has a non-punitive single entry point to preventative services. Within this recommendation, there's a number of sub-recommendations, and I would just call out that community-based family reconciliation services is one of those sub-recommendations. So as we're working to implement this plan, that's a recommendation among many others that we're going to be looking at as to our steering committee of young people with lived experience and caregivers. They might have a legislative agenda where they might be pushing that. All of our state agency partners and some of our advocacy partners, how can we push some of these recommendations with them? But that's just one example, again, of a recommendation within a recommendation that we really need to try to get some energy behind. But again, you can see the diversity of these recommendations as well. Changing zoning laws to enable more diverse and dense housing, job opportunities and support for people disproportionately impacted by homelessness and lack of access to higher paying entry-level jobs. And we have another slide on these focusing on anti-racism and government policy, programs and procedures, state-funded housing for pregnant and parenting teens and young adults. My office, the Office of Homeless Youth, we actually had a decision package for this the other year. It didn't get funded, but again, increasing opportunities for housing for pregnant and parenting teens and young adults is definitely one of our agency's priorities. And then another one is creating entry-level jobs in collaboration with private sector industries in the state. But again, these are the 10, between this slide and the other slide, those are the 10 high priority recommendations. And the youth homelessness prevention proviso. So this proviso, which came out of the state's operating budget for the 2023 to 2025 biennium, directs the Office of Homeless Youth and DCYF to co-lead a prevention work group. And the work group membership must include identified state agencies, community-based organizations, and young people and families with lived experience of housing instability, child welfare involvement, justice system involvement, or inpatient behavioral health involvement. So the young people and families in this case, that's our steering committee, which you talked about briefly before, and I'm going to give some updates on later. But that's the steering committee. And then we work with the Healthcare Authority, DCYF, the Developmental Disabilities Administration, Office of the Superintendent of Public Instruction, and a number of other state agencies, as well as I see some folks in the room here. We got some Mockingbird folks, some LCYC folks, working with them and a lot of other of our statewide advocacy orgs in this effort. But this is the larger work group structure, inclusive of that steering committee, that's responsible for implementing this plan. And it's not just the plan, as you can see, right? That's kind of the main body of work that this work group is tasked with, but it's also tasked with implementing many of the efforts related to substitute Senate Bill 6560, which set the goal that beginning January 1st of 2021, no young person in Washington state in a publicly funded system of care would exit from that publicly funded system of care into homelessness. We obviously have not reached that goal. We're still well behind it, but that's part of like what this work group is focused on as well. And it's also focused on implementing efforts from Substitute Senate Bill 5290 from 2019, which ended the use of detention. In most cases, it ended the use of detention for young people in the court system for reasons of like status offenses. So running away from home and that sort of thing. And then efforts to reform the Family Reconciliation Services program And as folks in this room might be familiar with, that program's kind of it's working on having an overhaul to become more community-based. If you've heard of the community-based family reconciliation services pilot, which I've referenced a couple times here. But again, this work group is responsible for the implementation of that youth homelessness prevention plan and efforts related to all these other things. And then the $200,000 a year provided to OHY to facilitate the participation of lived experts, that's the steering committee. So we will soon, we're actually currently in the process of developing a request for applications that we're actually going to be releasing in a week. And our hope is that we can identify what we refer to as a host organization. So a host organization that can support the steering committee. Right now, we haven't had one, so it's primarily been myself as well as my supervisor, Matt, trying our best to support the steering committee in developing this RFA, working on recruiting the remaining empty seats on the steering committee, as well as getting folks involved in some of the work groups that are starting to stand up. But this new host organization, they would end up taking the reins and be responsible for supporting the steering committee, processing like stipend payments so that steering committee members are compensated for their time. So we'll be releasing that RFA soon, and that is what the $200,000 a year is provided for. And then finally, this infographic here, this is incomplete. I will just say that we're working on a more full and accurate picture of how all of these work groups and things interrelate with each other. But as you see here, we have our youth homelessness prevention work group, and then the planning committee, which is the Office of Homeless Youth, the Department of Children, Youth and Families, the Healthcare Authority, and the subcommittee chairs of these subcommittees, which we don't have these subcommittees yet, so they haven't been stood up. But the planning committee kind of directs the overall efforts of the work group, make sure that we're kind of staying on point with an agenda, that we're incorporating everything that we're hearing from the subcommittees, and that we just have overall alignment between all the different things happening across the state. And then the universal and primary subcommittee, secondary subcommittee, and tertiary subcommittee, those spaces will more discreetly work on refining and implementing the actual recommendations from the plan. So for folks looking to get more involved in like action-oriented spaces where things are really happening, there's action steps coming out of those spaces that are assigned to folks. That's where that kind of stuff is going to happen, is in these subcommittees and in other spaces across state government. And then the youth homelessness prevention work group, that's again that overall governing body. So that's providing alignment between all those spaces and helping folks troubleshoot barriers as they come up. But this is like an incomplete look at this, and the most important thing of all of this is our steering committee of young folks and caregivers. As you see, they're encompassing this whole graphic, meaning that they're involved everywhere. So the steering committee, it might not be the entire steering committee that's in every space, but we will have a number of steering committee members in the prevention work group, in all of these subcommittees, in the planning committee, in a number of other spaces across the state. So there's always going to be representation there. And that's why they're encompassing that whole space. I will say I repurposed this presentation from a different space. So this isn't as relevant here. But I think what I would mention again is that steering committee, we currently have 8 seats filled, and we're supposed to have 23 total steering committee members. So we're currently recruiting for the remaining 15 seats. We officially put out an interest survey as well as a recruitment flyer. And we're hoping to start evaluating candidates as soon as the next week or two. So I will get that information out to folks. So for anyone in this room interested in applying for the steering committee, or if you want to just share it with your networks, that would be awesome. We're again just looking to recruit for those remaining open seats on the committee. And then just as another refresher, we have that RFA releasing on April 1st to identify who that new host organization will be. And we're hoping to make that award on July 1st. I will say a note on that, and we're not, I don't think it's really anything that we need to worry about too much, because I think it was just some confusion within the legislature, but in the Senate's budget, they did not include our youth homelessness prevention proviso, which is the funding for this steering committee and for the host organization to support them. Our understanding is that it was just a misunderstanding on their end, so hopefully we'll get that cleared up and we will have that funding. But that is just another thing that I would note, is that award for the host organization is subject to available funding, as with all the money that we award out to communities. And that is it. I apologize, y'all. I really I have a tendency to just fly through these presentations. So please like ask me to go back to any slides, or as like any questions or reflections came up during that. I'm happy to like answer anything and dive deeper into things. I know I probably missed a few things. Yeah, Alice.
Yeah, I just wanted to ask some more information on what like potential strategies and roads to these goals look like in the current legislative environment. I guess I'm not as well versed on the budget happenings. Specifically, I know there was a lot going on yesterday and such. So maybe things are in slightly less danger than I thought. But like, I agree with all of these projects. This just feels like some of them might be an immense struggle to get off the ground. And I think that's good. But I just was interested in what the strategies were surrounding that.
That's a really, really good question. I think that's what we're hoping to find out in the prevention work group. So with all of our partners in that space, one of the first things that we're probably going to want to do is set a goal, right? Like an end goal of how long do we think this plan, or how long do we want this plan to take, right? Do we want to try to reach this goal in 5 years? Is it going to be 6 years? Is it going to be 7 years? So we know it's not going to happen overnight, right? And this legislative session is almost over. But we definitely need to set a goal, and in that space, once we can set that, put a number of years to it, I think that's where a lot of that strategizing is going to come around. And we're going to be looking at first, what are the high priority recommendations and what are like immediate things that we can do. So I think, to your point, right, it's a really, really tough environment right now with the budget deficit. But what can we do with the funding that we do have? Things that maybe don't require a funding ask to the legislature. If it's just like internal agency policies, shifting the way that we provide services, we can try those things. So I can give one example. One of the recommendations from the plan is to implement a universal screener within schools to detect substance use and risk of homelessness. And we actually currently have a pilot site in the state at Rainier Beach. Rainier Beach High School is currently trying to implement this universal screener where every young person in that high school will get this assessment to determine whether they're at risk of substance use or homelessness, and they will be immediately referred to services upon that assessment. And that's an example of one of our universal prevention efforts. So there's different things like that, right, where we can just try to start small, more kind of grassroots, and build up. And I think that might be a lot of what we're going to have to do here with the budget environment. But I certainly am I'm definitely no expert on this, so definitely looking to like other folks in these spaces to guide this effort. I hope, please let me, if I can provide any more clarification.
I really appreciate that response. I really appreciate just the strategy of grassroots organizations and like intercommunity organization and trying to get that funding around and looking for alternative strategies. And while I do think there should be a significant priority put on things that are achievable at the moment, there should still be goals for achieving these longer term things. And I know you probably just don't have the specific answer to this, but because it's like in deliberation, but I still get concerned about those topics in priority that do not, that do require some amount of like state collaboration, be it changing zoning laws and stuff like that. With a current anti-DEI environment, is very hard to get off the ground. And, a lot of the prevention of that sort of Trump thought within Spokane exists much more in the esoteric, emotional, and individual mindsets. So I don't know. I'm not trying to ramble. I just am concerned about where the goals for these longer strategies are with the amount of uncertainty in the air on just getting the most basic, reasonable, cheap things funded or signed off on.
No, I definitely appreciate you bringing that up. I think it's a really good point. It is tough, right? And there are a number of recommendations in the plan that require like local buy-in, right? So local buy-in from like cities and counties. And that's, that's going to take some strategizing on our end on how we're going to involve cities and counties. What does that look like at a state level? What I will say is, I mean, like, Yeah, it's tough. I'm sorry. I wish I had more words for this. It's just super, super tough with, yeah, the environment that you just described as far as like how we're gonna push these things forward. But that's really, again, what this work group and these subcommittees are gonna be all about. And those high priority recommendations, like those will be the ones that we're gonna focus on first. So they are bigger, they're a little more bulky, there's a lot more involved, and they probably will require some funding. But like those are certainly, like, regardless of all of that, like the things that we're gonna keep front and center. So I wish I had a better answer to that question, but yeah, it's tough. But I think, yeah, we're gonna do a lot of goal setting in that group, and we're still in the very early stages of it. Like we don't even have the subcommittee set up. So I think there's a lot yet to be determined and figured out yet.
Yeah, no, I understand. Thank you so much for your response. I appreciate it. I would be interested in assisting the prevention work group in any way possible and stuff. Not trying to like squeeze my way in if there's more qualified members and such like that, but absolutely would like to extend my support. And thank you.
Absolutely. No, I appreciate it, Alice. And yeah, I will get that information set over to you. And yeah, hopefully we can connect about that. Yeah, talk more about the steering committee if that's interesting.
Thank you.
Sarah.
Yeah, Alice, I just want to thank you also for those comments, because I think that's, listening to the presentation and even the work I think all of us have done, it is kind of a shocking moment of how much work has been put into stuff and just not knowing what's next. So I salute all of us that we continue to show up, and like, again, there's a lot of work to be done. But I wanted to actually ask Isaac, can you go over what the qualifications are that you're looking for joining the committee that you spoke about, especially for the lived experts?
Yes, yes. So for folks looking to come onto the committee as a young person with lived experience, they need to be between the ages of 18 and 30 years old, and their experience of homelessness, housing instability, or systems involvement has to be between the ages of 12 and 24. So the experience has to be between the ages of 12 and 24, but you have to like currently be between the ages of 18 and 30, if that makes sense.
It does. Thank you.
And then for the caregiver piece, like folks can be any age. And it's just like what I mentioned earlier, when it comes to caregivers, bio, so parents or guardians, foster. So if they're like a foster parent or kin, so if they're like a relative or some sort of family member, or as well as informal. So just like maybe a community member, maybe a parent of a friend, and any one of those groups, right? Any one of those caregivers that has provided support, particularly like housing support, right? They've opened up their home to a young person, that would qualify as a caregiver. And yeah, there'd be no age restriction on that. Any other questions?
I don't see any other hands up.
But just say, yeah, I know it's a lot of information, but yeah, anyone feel free to like reach out to me. I'm happy to have like one-on-one meetings to talk more about all this. And yeah, I can put my email in the chat, and then Sarah, I'll send you these slides as well as links to the plan, both those plans, as well as that flyer, the recruitment flyer for the steering committee. So yeah, all those materials will hopefully get out to y'all. And yeah, I'm always available, so feel free to reach out.
Great. Thank you so much, Isaac. And I will also make sure again that I send out the recording of this video. So it'll go to this group as well as North Star Advocates' larger email list. And with that, I'm actually going to stop recording the meeting. So just give me one moment.